Honestly, I'm really happy to be here in front of you presenting this interesting topic, which was introduced by Prof. Hajar and Prof. Farid in the morning. Can I have my presentation, please? So as they mentioned, there is a big evolution in the activation time of CI devices over past years. It dropped from 6 weeks to 4 weeks, then 5 days, and now it could be done on the second day or even at the same day of surgery. Here is the scientific contribution of King Abdullah Ear Specialist Center in the early activation journey as a pioneer center in this practice. So in 2014, we published a paper about early activation 5 days post-op. In 2015, we published a paper about visibility of one-day activation. In 2022, we published a systematic review about early activation. In 2023, we published the journey of early activation from weeks to hours. So our systematic review was published in European Archive, and just between 2014 and 2021, we found 19 papers on early activation, which recruited more than 1,000 patients underwent this technique. So we studied the impact of early activation on many aspects, including visibility, safety, complications, hearing and speech perception, and patient perspective and economic evaluation. And this study showed that the early activation is feasible, safe, with no major complication. After that, we decided to study the impact of early activation in electrode impedance. So our objective was to assess the effect of early activation on electrode impedance up to 2 years and to compare the electrode impedance trends among early and classically activated patients. So it was a retrospective study in 2 groups, early activation group and the classical group. Both groups are matched in classic minimally invasive CI technique, round window insertion, and same electrode design. We included all patients with normal inner ear anatomy, either underwent unilateral or bilateral CI, same electrode design, round window insertion, normal intra-op measurement, and normal electrode position confirmed by post-op imaging. We excluded all patients with history of meningitis, head trauma, revision cases, and patients with incomplete data or abnormal impedance. So we measured the impedance before switch-in at different time intervals. Before switch-in, then at 1 month, then at 1 year, then at 2 years. As you can see in this graph, the green color is the early activation group and the red color is the classical activation group. You will notice a lower impedance with early activation group at different time intervals, either pre-activation, 1 month, 1 year, and 2 years, in all electrode region, apical, middle, and basal electrodes. Also here you will notice a significant decrease in the impedance value at different time intervals with early activation group compared to the classical group, which is the red dots. This graph showed the impedance trend over time. You will see this last one, it's about overall impedance. The trend of early activation start very low impedance, then start to rise a little bit up, then it will decrease over time. So in conclusion, this study suggests a beneficial impact of early activation on electrode impedance over 2 years. Electrode impedance keeps changing over time up to 2 years. Electrode impedance of early activated patient was significantly lower at different time intervals. Reduction of electrode impedance with early activation was prominent in the apical region. Early activation is safe and feasible, and this might give a better hearing preservation and provide more patients with a better outcome in CI treatment. So every single attempt toward bringing hearing back as fast as possible to deaf patients and henceforth engaging them in society does matter. The earlier the better. Thank you.